Hi. Hello, everybody. Welcome to Knock Knock Hi with the Glaucomfleckens. I am Will Flannery, also known as Dr. Glaucomflecken.
I am Kristen Flannery, also known as Lady Glaucomflecken.
Welcome to our episode today where we talk to a neurosurgeon.
That's right. It's a very nice one.
Oh, very nice. Like it's one I love. So we're talking to Dr. Betsy Grunch, board certified neurosurgeon, also lady spine doc, which I had trouble putting those three words together so many times during the episode for some reason. I was going like lady neuro, lady. I knew lady was in it, and then I don't know. I was struggling today, but it's lady,
your ophthalmologist was really showing
at Lady Spine Doc, and I love her content. It's great stuff. And had a wide-ranging conversation with her. But it does, truth be told, neurosurgeons are still, they're a bit intimidating to me.
Yeah, they scare you.
I'm a tiny bit scared. She's very nice, but just like the thought of like talking to a neurosurgeon. I've done that. I've had to do that one time in like the past 5 years.
Yeah.
And I still remember it. I was like, oh, why am I so nervous to talk to this person who's like, we're both like attending physicians and professionals, and like, why do I feel like I'm like a med student again?
Yeah,
I don't know.
I don't know either. I have talked to neurosurgeons many times because I needed to have a neurosurgeon, and they were all delightful. Everybody that I talked to.
I feel like I need to have a disclaimer in all of my videos.
Yes,
it's like, this is not a real neurosurgeon in this video.
What happened to you?
This is a caricature of neurosurgeons. There are elements of truth in this neurosurgeon's personality. Namely, yes, if they could, they would just live at the hospital in the operating room. But not totally true, although we do talk a lot about how she's always on call.
Yes, but also work hour restrictions and family life as a neurosurgeon.
You can still have a life with anything in medicine. Sometimes it's just a little bit harder.
Easier than others,
yes, exactly. But it's fun to talk to her.
Yeah.
I love what she does. I definitely want to support all like, professional, like accurate voices in medicine on social media.
Yeah.
Right? We need to be like
providing like education to people and good role models.
Quality
education, and all of that.
Good role models. Absolutely. Couldn't have said it better myself.
I also really love her particular just brand of, I don't know, humor or maybe it's just her personality. She's super sharp and dry and a little sassy, which really that's an okay in my book.
In my opinion, the drier the sense of humor, the better. I love it. Love it so much. Just bone dry. Mm-hmm. The Nathan Fielder brand of comedy.
Except he takes it so far that I get uncomfortable. But yes.
All right, let's get to it. Here is Dr. Betsy Grunch. Today's episode is brought to you by the DAX Copilot from Microsoft. DAX Copilot is your AI assistant for automating clinical documentation and workflows, helping you to be more efficient and reduce the administrative burden that causes us to feel overwhelmed and burnt out. To learn more about how DAX Copilot can help reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit aka.ms/knockknockhi. That's aka.ms/knockknockhi. All right, we are here with Dr. Betsy Grunch. Dr. Grunch, thank you so much for joining us.
Thanks for having me. Super excited.
Yeah, I'm a big fan of yours. In fact, I was just looking at your TikTok account, and I saw a video that was like at the end of your 72-hour call shift. And then I saw another video that you posted like maybe 5 hours ago about how you are post-call today. So my question, are you ever not post-call? Like,
when she's on call.
Well, when you're on call, and I guess there's always on call or post-call, but do you ever have a break?
I think it's like a perpetual thing. So when you're post-call, then you're on call, and it just cycles.
It never ends.
Never ends.
But honestly, how often, like, what's your call schedule like?
So I'm 1 in 5. So we have 5 neurosurgeons at our hospital. And so I'm always on call like once a week, basically, and then 1 in 5 weekends. So it's not terrible. It used to be 1 in 3. It's been as good as 1 in 7 at one point in a magical lifetime that seems like an eternity ago, but we're here.
Well, 1 in 3, was that residency or even post training?
Oh no, that was here. That was here. Residency, I think it was just continuously on.
It just never ended.
Right.
Well, should we compare? Because I'm actually just coming to the end of my call.
If you would like, I will punch him in the face.
No,
once
please,
you hear this,
just a little,
just on your behalf.
Any eye emergencies?
I did. I went in to see 2 patients.
Yeah, you had to go to the hospital.
I did. I went to the hospital and maybe took a couple of photos with some people while I was there. It happens. It happens.
Barf.
But I didn't have no
you
emergency
must be drained.
surgeries. I had to take a couple of other phone calls as well from home.
That was hard for you.
Is sometimes could be a challenge. No, how many emergency surgeries did you have to do on your last call shift?
Oh Lord! So I've been on call since Friday, and I did emergency cases Saturday, Sunday, and then actually I was supposed to be in the office today and ended up doing 2 emergency cases this morning. So I had to cancel my entire clinic, and here I am. So yeah.
Wow. Well, I feel honored. We made the cut.
Right? For sure.
I got done just in time to be here with you guys. So,
well, we definitely appreciate it. And let's start with your social media presence, because I love what you do on TikTok in particular. That's where I see all your stuff. Lady Spine Doc.
yes.
So tell us the origin of this.
So the origin of the kind of social media presence began around the pandemic. So I started becoming obviously more bored because as a neurosurgeon, I'm never really bored. But we got in this situation where we couldn't operate. And so there was an exuberant amount of time that I had to peruse social media. And I've always liked social media. I've always used it, never really used it professionally or didn't know in some capacity. And actually, believe it or not, you were kind of an inspiration because I just loved your funny content. It kind of got me through good days, bad days, and some other creators. And I thought, I can do this too. So me and my PA made a few reels, and I came home one day and made a reel about being a female surgeon, being a female neurosurgeon. And I was posting it. I posted it in TikTok to post to Instagram just so I could download it. And I had like 2 TikTok followers or something like that, my mom and my husband. And then I went to bed, I woke up, and the video had like several 100,000 views. And I was just like kind of taken back because I didn't even know that, it could do that. On Instagram, it just went to your followers. So I didn't realize that people could see your content. So I was kind of like overwhelmed with the feedback I got, some negative, some positive. But it was just, how it goes. So it was a really cool, it was a cool thing for me. I thought I could reach a lot of people. And so I started, thinking about doing more stuff online just because of that video really just kind of inspired me. And mostly because of people that were wanting to know questions about being a female surgeon, about, going into neurosurgery. And so I started, I took it as a challenge. So I decided I would post once a day for 30 days. For 3 months, because that's what I read according to my research that you could grow. So I did that. And like in 3 months, I had 100,000 followers, and here we are.
That's such a physician. That's such a physician approach to social media. I did my research and I figured out.
I'm following the prescription.
Yeah,
this is what you do.
Once a day, an apple a day.
Well, it was like that was a time. I mean, that's when I got started on TikTok as well, right? And I'm sure, like as a surgeon, you're, being told you can't operate is like maybe the worst thing that can happen to you. Almost
probably the worst
in life. And so, to fill that time with something, and And so I'm right there with you. It was, I don't think I was diligent enough to post every day for like 3 months. That's impressive. That's good for you.
Well, you know how type A personalities are. I don't.
But and the algorithm though of TikTok is what really like propelled.
Yeah.
You know, like you're talking about, you just came back and had all these views that you don't get on other social media platforms, which is part of the reason why I think TikTok blew up right around that time.
Yep.
But let's talk about, so tell me about just being a woman neurosurgeon, and because that's, as you mentioned, was initially part of your platform and what you talked a lot about. Neurosurgery, I think more so than other specialties, is probably even more male dominated. I don't know the numbers. Do you know, like what? I'm sure you can tell me.
Yeah.
What percentage?
There's 243 board certified female neurosurgeons in the United States. So it's not many of us. That's about 9%. So not many. And residency currently there's about 20%. So hopefully over time those numbers will change as it cycles through. But it's still nowhere near what the incoming medical schools, over 50% female. So there are just certain fields like neurosurgery, orthopedics, urology, those kind of specialties where it's just extremely male dominated. And there could be a whole nother discussion as to why that is. But yeah.
I'm sure. But were there any example things in your training, like where has this manifested as far as like people always expecting a male neurosurgeon? Because I'm sure you've probably felt that. I mean, that probably led to your name as Lady Spine Doc on social media, right?
Yeah. I mean, the main reason why I came up with that name, I was trying to come up with something that kind of set me apart, because I've followed other accounts, and what I knew about content creators is like, I couldn't always remember their last name. I don't know who that doctor is that I follow, but I knew that they were like, a plastic surgeon or a pediatric. So I wanted to come up with something that kind of set me apart. So I had this experience, just to kind of describe how I came up with my name. I had this experience early on when I first came out of practice, and I went to go talk to this patient's family about this big, long surgery that I did, this complete spine reconstruction, and spent 5 hours, fixing this man's spine. I came out to talk to family, sat down, explained the whole procedure, what I did, the recovery, how well it went. And at the end of the conversation, he looked at me and he was like, okay, well, when's the surgeon going to come and talk to us? And I was just like, okay, well, she's actually me. And he looked at me and he was like, a lady back doctor. Good for you. And it was just like, it was so condescending, but
is this a good for you, like a Southern good for you, like a bless your heart?
Bless your heart. That's exactly what it was. And
well, good for you.
Good for you. And I was just kind of like, pissed, kind of, but also like in a way, like it came from a good spot. Like he was genuinely like proud of me. And I thought, well, I can break this stereotype. If he had no idea that I could even possibly be a surgeon, that we'll change the dynamic up here. So that whole experience is kind of perpetuated through my career. But that's kind of one of the reasons why I came up with that name, is Lady Spine Doc. It's because of that, and it just kind of stuck, and that's where we're at. So people know. It's funny you mentioned, like, you being out on call and people wanting to take pictures. It's kind of like that. No one knows my name, Betsy Grunch. The name is, hey, are you Lady Spine Doc? It's like, yep, that's me.
Yeah, most people think his last name actually is Glaucomflecken. Like they're surprised and a little disgusted when they hear his actual name.
Yeah.
No,
that doesn't feel right.
Yeah,
no.
they want me to be called Dr. Glauc. I mean, you're smart, and I'd say most physicians on social media are pretty smart about it. They have something in their name that tells people what type of doctor they are. I think that's one of the big mistakes I made. It's not obvious.
Why did you come up with the name Glaucomflecken?
Yeah, it's a good question. It's just the silliest word I could think of in ophthalmology. That was
literally his criteria.
It's an actual ophthalmology term, and so I don't know. Could have done it differently, but
it's good. I like it. I like it. I thought it had something to do with.
Yeah, right. But you're so primarily a spine surgeon, I guess.
I do.
Because
I do mostly.
help us out, because with neurosurgery you can go in a lot of different ways. The
spine
nervous
surgery.
Right. The central nervous system is a large thing that can brain versus spine.
But there's like neuro versus ortho. Like you can.
Oh yeah, you can go to spine from different places.
Right. Yeah. I mean, you can be a spine surgeon as an orthopedic or as neuro, and
you guys like each other.
I think we like to arm wrestle a little bit. I'm not as strong as some of the ortho bros, but we try. I've been working on that, but no. So I am a general neurosurgeon. I did a spine fellowship, and spine is kind of I do about 95% spine, but I still do cranial stuff and brain stuff, peripheral nerve stuff. So I'm technically a general practice neurosurgeon, but my heart is spine, and that's mostly what I practice. So that's how I stick with that name, because I that's kind of my background. But it's funny because oftentimes people think that I'm a chiropractor. So that's fine.
Right.
Oh no.
No.
Man.
Yeah.
Which is a particularly dark area of TikTok.
Yeah.
There's some, chiropractic.
Yeah, I try to stay out of that area because I don't want to get down that deep dark cave. But yeah.
Do you have to do a lot of education though? Because people is that a large part of your content?
I think
hopefully not a large part.
No, I don't. I don't like to go down there because it always gets engagement, but engagement isn't always good. So
definitely.
No, I initially I did. I think a lot of people, but I think now I've kind of established my presence. Most people know that, or if they don't, then my viewers will quickly correct them. So we'll just let them fight it out for me.
Well, that's actually a good point, because you start, because I have these things too that I have to debunk fairly regularly, and then people start doing it for you, which is great. And I guess that's what you want,
posse.
right? Right. You want enough people out there who are willing to go to bat for that perspective and that scientific perspective versus whatever the hell it's chiropractic, whatever it is.
Right.
But getting back to like this ortho versus neuro, I'm kind of fascinated by these types of overlaps. Like we don't have really a lot of that in ophthalmology. You go to conferences. Do you go? Are there neuro spine and ortho spine? Do you guys come together and who gets the rowdiest? Like what is the dynamic between the two?
So we have neurosurgery conferences, and there are orthopedic conferences, but there are some mixed like spine conferences. A couple. Actually, I am the chairwoman of the spine section meeting at this orthopedic summit that's coming up in Vegas in a couple of months, and so I was a little nervous because it's all orthopedic, and I've never really chaired a orthopedic meeting. So, but yeah, I mean, it's a good space. I think we all learn from each other because we train very differently, and the thought process is similar, but always a little different, and it's kind of fun to learn from them and them learn from us and vice versa. And where I trained, there was even like cases where we did them conjoined. So like ortho would put in the screws and neuro would do the decompression. And that's very, very old school. It's not the case anymore, but that's still the way some people practice. So it's kind of fun kind of mixing up, but I'll tell you the personalities between a neurosurgeon and orthopedic surgeon are quite vastly different.
How would you rate his depictions of the two?
Yeah.
Pretty accurate. Pretty accurate. Yeah. Yeah.
Are you renting out space in the blanket warmer, for in between cases, you kind of hang out there.
I need to. Yeah. It would be a much better place for me, but instead I just have my heated vest and I just go curl up in the surgeon's lounge. So it's similar.
Yeah.
Love it. Well, I want to talk, actually, let's take a short break and we'll come back because I want to explore some of the factors you alluded to that lead to a male-dominated field.
Okay.
I'll be right back. All right, we're back with Dr. Betsy Grunch, board-certified neurosurgeon. So I want to explore this a little bit because, this is we mentioned ortho and neuro. I mean, this is an issue probably across most surgical fields, to be honest, in medicine, where it's very heavily male-dominated. And you mentioned, like, we could get into some of the reasons why you think that might be the case. So, enlighten us. What do you think it is that is...
enlighten you, I think.
Oh, okay. Well, I mean us as in the audience, as in the people listening, because I think this is an interesting subject and an important one.
Yeah, it definitely is.
Yeah. I always think of it as like when you're a student, you're in this very malleable phase in your career. And a lot of people go into medical school and they have no idea what they want to do. And much like, some people are like myself. I mean, I knew I wanted to do neurosurgery. There was nothing deterring me from that path. I didn't care what came in my way. So you have those kind of folks, and they usually don't change their mind. And then you have, people that are kind of on the fence. And I think that's a majority. So you, as a student, go into an environment where you're learning and trying to fit in and trying to figure out your ways and where you might see yourself for the rest of your life. And if you go into this environment as a woman and you go into the operating room with a bunch of neurosurgeons, male dominated, talking about guy stuff, and you kind of feel like the outsider and, you don't feel like you fit in. And so you may feel like you're not smart enough, you're not good enough, you're not cool enough, or you don't have the same commonalities to have a open discussion. And you kind of feel, like I said, kind of like the outsider. And then you may go into another rotation. Let's just say OBGYN, heavily female dominated. You might have a great experience. You have people just like you, attendings just like you. You have cool conversations. You lift to Taylor Swift in the operating room. This is a cool place to be. I like it. I like vaginas. I want to do OBGYN now. So, those kind of perceptions as students really, really sway your decisions and what career path you go into. And I think that's one reason why people don't choose those specialties. And then, the obvious is that females in their reproductive years, thinking about what they might do from a family perspective, a lifestyle perspective, when they're going to have kids, going into a surgery specialty where you see that as not really quite conducive to that, it will also sway. So there's multiple kind of reasons. Your training's very long, as you like to point out on your social medias. We don't graduate until we're well eligible for AARP. So, it's all those things in combination will kind of weed out those people that may be on the fence. And if they have a great experience, it may sway them. But for the large majority of the time, I mean, as a group of neurosurgeons, as much as I like to think we're cool, we're not really that cool. We're not really that fun sometimes. We do hard things. We have hard cases. We have shitty outcomes sometimes, and people die, and it sucks. And, so I think
you're doing incredibly cool things, though.
We're trying to change the game here. We're trying to show really how cool we are.
Yeah.
I'm trying to.
Have you found that, I mean, you mentioned it from like the applicant's perspective, but have you found kind of the flip side of the coin to be true or not, that it's not just about the woman thinking about when is, I would like to have a family, when is that going to happen and how? That's certainly one. But have you also found that like men in the field are just, or even women in the field have that expectation as well, because these are women in their childbearing years that are applying? And, do you in your experience, did you, maybe not you personally, but did you encounter or see that happening at all, or no?
Absolutely. I mean, I came into medical school single, residency training single, so I didn't really know kind of what I knew. I kind of thought I wanted to have a family, but I went into all that with that not being a big factor in my life at the time. And so having those conversations were very easy. Like, hey, do you plan on having kids? I'm like, I don't know. And, my passion at this moment is becoming a neurosurgeon. And so those things kind of helped me. But, I did have colleagues that were married, or, I did not have any female colleagues that had children so that those things do weigh into how you're treated, coming into the field. And, it's tough. I mean, it's definitely the elephant in the room in these cases. And I'll say even now, like, I went through training with a few women, and one that had a child during residency. And it's not an easy feat, even though we think that, we like to think that we've changed and be supportive. But God, it's hard. I don't even know how I had my kids out of training. And if I had been at that time of my life during training, I don't know how I would have done it. I mean, it's just a hard process. And the flip side of having a children in a family is an extremely also grueling, hard process that you need lots of support with. So,
yeah, that's the thing that kind of pushes my buttons on all this is like, I mean, having a child and being a parent is hard and a lot of work, no matter who you are and what your gender is and all of these things. But I think that as a society, or at least, maybe it's changing now, but at least as we have been coming up in our careers, it's been almost seen as like an issue of ours, right? That we are going to find it hard to do these things, or we're just going to miss our child so much that how will we ever be able to concentrate on our work? Things like this. When I think it would be so much easier if there were just some sort of structural and societal supports in place. Like, it doesn't have to be quite so hard, right?
Exactly.
Like, fathers have been doing it forever because our society is based around providing them all the support they need to be able to leave the home and go do a job. And so if we had a similar setup for just all parents, I think it could be a lot easier. So I think sometimes we perpetuate this problem ourselves as people because we're not doing those things.
Absolutely. And I think, kind of the expectation of a man going right back to work after their wife having a child is really kind of comical as well, because, they're needed at home. So I think if we had these expectations of all people, regardless of who birthed the child, and expectations as a society of time off and caregiving, it would make everything, all careers, not even physicians, just a much more supportive place for families and growth. So maybe that's a long, far-fetched dream, but I think it's something to really think about.
Something to work toward, right? And I mean, you mentioned now the new classes of neurosurgery residents coming in are like 20% women,
female,
and what do you? Obviously, part of that is like like you said, having students see that representation, right? They're coming and they're seeing, female neurosurgeon attendings, and do you think there are any other factors that are contributing to this shift to more women coming up in neurosurgery?
I think that the tables are turning just in general as a society of what we think women can do. And the more women perpetuates more women for the reasons like what people see me on social media and think, hey, there is women in the field, I can do it. Or my kids, like if I ask my kids, like show them, I did this TikTok trend about a year ago or two. You show them a picture of a person in a white coat, a woman in the white coat, and a man in a white coat, and ask them who's the doctor as they point the woman, because they're used to seeing me. Aww. And, it's just what they're trained on. So the more we kind of change that societal wave, I think the expectations of what young girls think that they can do will continue to change, or even ethnicities as well. And I did some background research on this kind of societal developmental change and what we would consider like to be an appropriate percentage. Like, obviously, I wouldn't expect there to be 50% women. That ideally, that would be representation of the population. But what would be an acceptable percentage is about 30%, because that will mean a certain percentage will kind of weigh into the beliefs and you think of like how we make our decisions as a society, a neurosurgical society on ways we treat patients and changes. And if we have a certain percentage of people contributing to that ideas, where are we represented as a culture? And so the number is around 30%. And the Journal of Neurosurgery did this article on how long we think it would be to be 30% women. And it's projected to be like 30 years or something. So it's not something that's rapidly changing.
It's almost an entire neurosurgery residency.
Yeah, that's right.
Exactly.
Man.
Exactly.
Well, I think what you're doing is important, not just for little girls to see themselves doing this, but for old men to see you doing this.
That's true.
I mean, I'm 100% serious.
No, yeah, I know you are.
People who are currently the decision makers and the culture setters and all of this, like they need to also see, here's this successful woman with a family who's a neurosurgeon and has a social media. Like they need to see that we're not these little delicate, flowers that can only do one thing and need to be at home. Like I think it's helpful for men to see as well, and little boys, as well as little girls.
Yeah,
I agree. Yeah,
there's a lot of toxicity in medicine.
Yeah,
that by
a little.
Yeah, just a little. In fact, you shared with us this story from your first day of internship at Duke, which just encapsulates this the issue just very nicely in terms of, or at least one of the issues in terms of the toxicity in medicine, in particular surgery, that's been present for a long time. Can you tell us about that?
Yes. Yeah. So I would like to disclose that fortunately this tradition has since ceased since my internship. However, my first day of internship, we went in, and at Duke, at the time, I had to do a general surgery internship. There wasn't a straight to neurosurgery. So you did 1 year general surgery, 5 years neurosurgery. And so this was the general surgery internship meeting, if you will. And at the time, Duke was a very incredibly toxic, particularly in general surgery. And they had the interns wearing the short white coats, the white pants, the white shoes. So we literally looked, yes. Let me tell you, it's hard to find white pants in the middle of winter.
Short white coats and white pants. Okay.
And yep. So you can see kind of how it starts as day one. That's what you're expected to wear. And you already feel like the low person on the totem pole, and it's designed to be that way. I mean, you're meant to feel that way. And so we went into this meeting with the residency coordinator, chairman, and they give us this pamphlet, and I have it somewhere in here. I should have got it out, but it's How to Swim with Sharks. And it's a trifold pamphlet that you open up, and then they explain this trifold pamphlet, and it is stating that you are the tadpole that is in the shark pool, i.e. the intern in with all these other physicians, and you cannot bleed, because if you bleed, you will attract the sharks to then subsequently attack you. So you're basically told that you just need to do your work and never complain, never cry, never report anything, and you just do your job and you'll be just fine in your shark pool.
This was a pamphlet?
Oh, yeah.
This was like written down and...
distributed year after year.
I can find it.
Were there illustrations in this? I hope so.
I think that there were illustrations.
Oh my God. Okay.
And I kept it just because of how horrible it was of an experience for me. I mean, it made sense to me at the time. I'm like, I don't want to bleed. I need to just fucking do it. So it's like, all right, here we go. So anyway, I mean, and that's how it was then. And, we weren't treated great, and we were treated as we, should not have been. But that was the way, that was the way residency was. And that's in the change in the tide of change of my residency. That was at the time that ACGME started the 80-hour work week about halfway through my residency, which was also seen as a joke at the time, especially at Duke Neurosurgery. Like, they're doing these hours, but please don't report them because you will get us in trouble. So it was an interesting 6 years of my life.
Yeah, I can't imagine those early years of the 80-hour work week were were followed very diligently by many programs. Mostly this, I mean, and that's the thing with this type of toxicity. You see it more in certain specialties, right? Like I graduated residency in 2017, so I did all my training in the work hour restriction time.
What year did that go into effect?
It was 2011.
Okay.
I think something when the 80-hour work. So I finished my training in 2013. I was 2007 to 2013. So in the middle of my residency is where they implemented it.
And that just shows like we're not talking like long ago.
Right.
That's something to take home there. Like this pamphlet you received, this was like all like maybe 10 years ago. And it was even worse. Like before that. So, but what is it about surgery? I mean, is it just the stress of is it more of a historical thing? Like when surgeons were known as like the gods of the hospital, right? Like, the most important people, like where was that perpetuated why was it perpetuated so much in surgery, you think, versus other fields?
Yeah, I think it's just the nature of surgeons kind of attitude from a multitude of reasons, how they're treated at the hospital, how they are treated in the operating room. And ultimately, people see neurosurgery as one of the highest kind of hierarchical fields in medicine. And surgeons sometimes feel like they are God, like whatever they do, there's not many of us. You can't fire us. You need us. The hospital needs them. So they can act and behave and treat people how they want it. And therefore, you see, and that's how it's perpetuated. Like I grew up in a time and trained during a time where I saw surgeons acting like that, yelling at the scrub techs, yelling at the residents. And then I think, well, that's how I'm supposed to act. That's my normal behavior. It's okay to do that. And so then you learn, it's a learned behavior. Then you act like you can then treat that. And of course, tides are changing now, and now people don't tolerate that type of behavior. But I've only been in practice for 10 years, and that's how I was trained. And initially came out like thinking that's okay to treat people that way. And then you realize you don't win a lot of battles acting like a 2-year-old toddler throwing a tantrum in the middle of the operating room if you don't get what you want. It's much better if you just kind of act like a normal human being. So,
That's right. Do you feel like I ever act like that?
Like a 2-year-old?
Yeah.
Well, I mean, we have a skeleton behind us with a unicorn headband on. Yes.
We put this, so we have our skeleton out, Gerald, we put this out for you, Dr. Grunch.
I love him. I love him.
It's so...
We should have turned it around, though. You can't see the spine very well.
That's fine. I have my skeleton head right there.
Yeah.
So, yeah.
That's good.
And brain right there.
So it's I do feel like you mentioned, it's the tide is starting to turn, and I honestly credit social media with some of that. I think that allowing different opinions about toxicity in medicine and how people should be treated within the healthcare field, talking about moral injury and burnout and all of these topics being so public, I feel like has just put gas on the fire of change to make medicine a less toxic place. But I mean, we're not far removed from giving out pamphlets we're saying don't bleed because the sharks will eat you. And so I think we still have a long way to go,
Yeah, I agree with that 100%. And I think just me being, a content creator and being cognizant and getting feedback from people on stuff I post, and it's really changed me as a person for the better too, and a better physician, a better human, just because I can see other sides of the story, and maybe something that I put out there maybe interpreted a certain way that I had no idea would really be interpreted that way, or watching other, nurses or other people in the hospital and their content and how they're treated makes me more aware of things that we put our people in healthcare through. And so I do agree with you. I think social media is good because it allows us to amplify things that are acceptable and not acceptable, and allows us to change and learn and grow. And those people that are more willing to be moldable and changing and instituting that change and being leaders on to help initiate and vocalize with big platforms to talk about these issues that are not talked about enough. So
I have a question for you. Does the long hour, because you don't, as an attending nurse, you don't have work hour restrictions.
No.
Right. So how do you handle, what's the, what are the expectations for you, or are they restrictions you put on yourself at times? Like, how do you, because I'm sure there are some times when you feel like you really can't go on. Like, how do you manage that? Because it's got to come from you as an attending, right?
Yeah.
Or are there restrictions that the hospital like helps with, or like, I guess, how do you manage that situation?
Yeah, that's a great point. And a lot of people bring that up in these videos. You mentioned that vlog that I did, the 72-hour vlog, and all the things I get. How is this possible? How can you do that? There's work hour restrictions. There's not. I mean, even pilots have work hour restrictions. Residents have work hour restrictions. But people like me who are doing this work, I have 0 work hour restrictions. And I've been on call since Friday at 7 a.m. and it's Monday now at 4 p.m. and I just finished my work. And I haven't been up that whole time, but have been continuously woken up and have not gotten a full night's sleep. And that is something that wears on you over the years. And there are good days and bad days. And, earlier when I was younger, I tolerated it really well because I thought that was normal. It's how I grew up in residency and how I trained myself. And you kind of, I think, in some ways it's good as residents to get stressed and work under harsh conditions because it does train you for real life. But I personally have just taken this, past few months, even the past year, to really reflect on that as a person, as a mom, how I'm pulled away from my family during these types of situations to really put more restrictions on myself. And, actually moving forward, when I am on like a weekend call like this, I just had this group with my partner the other day. We've decided that we're going to have to take a day off. Not if it's not just to kind of catch up on rest, it's just to kind of catch up on cases. Because like I said, I had a full day of clinic today and I couldn't even do it because of where I was being pulled. But I mean, in private practice, which is where I'm in, there are no restrictions. And what I put on my work, I could be up for a week straight and no one would care. And people would still expect me to work and they would want me to be there.
Patients will care. I just
Some patients will care.
I think patients don't always know the situation.
They won't know.
But I mean, I've been along for this whole ride since before med school, right? So like that's one of the things I've been saying this entire time is like, one, isn't it ironic that you people, like, who knows more about taking care of the body and the brain than a neurosurgeon? And two, like, I don't want somebody that's been up for like however many hours in a row or isn't well rested or whatever. Like, I would prefer that if my brain is being operated on, that the person has, slept well. That's just me, but I feel like a lot of patients might agree with me. Like, I would be in favor of work hour restrictions for all of my physicians.
No,
but
I agree.
I think a lot of people would agree with you.
I think a lot of people would agree with you, but I will argue that a lot of people will not agree with you because I've had patients genuinely upset for moving cases around or canceling cases or expect me to like, oh, the case is delayed till 11 o'clock. Well, why aren't you doing it? Like, well, I probably should sleep and I probably shouldn't be awake operating on you right now. And it's tough, but I think right. I think patients should be more educated too. And social media would be great for this too, about like, what is it that is causing these things, right?
Yeah, what's preventing you from being able to get enough sleep that you feel like you can function at 100%. And
right.
It's because it's not like you're choosing to do this, when you're tired. It's because part of it's necessity and you're trained to be able to do it.
Right.
With being not well rested, and maybe that's part of the problem too. But it's definitely a multifactorial
for sure
issue, and I think the more education that's done around it, the better. Because you're right. Like, people need to know all the reasons, and
because I think the general layperson, let's say, kind of sees healthcare as any other consumer model, right? Where, well, I have an appointment at this time, so why aren't you seeing it? I know we've gone over that ad nauseum, but it's the same issue of like, well, they just we don't always know what's behind the curtain, you know, and then it creates this friction between patient and doctor. But anyway, that's a whole other podcast episode we could do. Well, probably have done.
I want to take one more break, and then we're gonna have a little game to play.
Okay.
Hey, Kristen.
Yeah.
I think you've been neglecting our little friends here.
Oh. Do they need some attention?
They do, from you in particular.
Oh, okay.
Yeah, they're your favorite, the Demodex mites.
Love it. Love a good mite.
They're so cute, but they can cause problems.
Yep.
Yeah, if you get like red, itchy, irritated eyelids, it could be caused by these little guys.
That would not seem very fun.
Demodex blepharitis, they can't help it. They're just living their lives.
Guess so.
But it's not fun.
No, not for the human.
And they're a lot smaller than this.
That's good. I'm very thankful for that.
They're not quite as cute, but almost.
Okay.
All right, but this is not something you should get freaked out by.
Okay.
All right, you got to get checked out.
Yes.
To learn more about how Demodex blepharitis can affect you, to find out more, you go to eyelidcheck.com. Okay. That's EYELID check.com to get more information about Demodex blepharitis. All right, we are back with Dr. Grunch. Betsy, we have a game that's admittedly incredibly challenging.
I'm ready.
This is like,
I've trained my whole life for this moment.
No, you have not trained for this moment. This is to forget MCAT, step 1, your neurosurgery boards. Like, I promise you, if you pass this, I will be incredibly impressed. So the game is called Is It Spineless? As a spine doc, you're big into spines. You love spines. So here we go. This is how the game is played.
Oh, no.
I will give you the Latin name of an organism.
Oh,
you
no.
will have to guess if that organism is a vertebrate or an invertebrate.
I need my 9-year-old to help me with this.
Kristen's going to play with you. Yeah. So the two of you are going to be.
But I can see the answers.
No, I'm hiding the answers from you. Okay. All right, here we go. All right. The first one, Panthera leo, Leo. Panthera.
And I'm supposed to say invertebrate or vertebrate?
Yeah, you think that's and bonus points if you can tell me what animal that is. Panthera. Invertebrate. That is a vertebrate. That is a lion. Leo. Leo.
And Panthera, that sounds like panther.
Panther.
Okay. I'm going to fail this.
I told you.
This is not good.
I told you this is going to be hard. Here we go. Next one. All right, I think you'll get this one. Octopus vulgaris.
Oh, well.
I'm going to go with invertebrate.
Invertebrate. What kind of animal is that?
It's an octopus.
Octopus. Invertebrate. You got it. Okay, you got it. All right. This is one. I like this one a lot.
Okay.
Gallus.
Spell it.
Gallus.
Okay.
You guys can work on this one together.
I have no idea.
Yeah, I don't either.
I'm going to guess invertebrate, but I don't know. I'm going to be wrong.
That's a vertebrate. That's a chicken.
A chicken?
A chicken.
Gallus. I should know that. I live in the poultry capital of the world.
Oh.
Yeah, I don't think anybody's
using
Gallus.
I don't think anybody's using Latin names for chicken.
No.
Anywhere.
Yes. Open a restaurant, it'll be a big hit.
Gallus. Yes. I love it.
Gallus. There you go. Oh, that's actually pretty good. I like that.
But it needs to be in Dallas.
Gallus in Dallas?
Yeah.
Oh, I like that. That's good.
Dallas.
All right, I'll do a couple more here because this is
free business ideas for the taking here.
We're killing it
miserably. Yeah. This is really bad. All right. Echinaster suppositus.
Well, it's got a rectum.
Echinaster.
I know that.
What?
Suppositus sounds interesting.
Sounds like it's got a rectum.
I would say it does not have a rectum. It lives in water.
Okay, invertebrate.
Yes.
If it's got no rectum, I'm going to guess that's an invertebrate. I mean, I don't know what the correlation is between them, but I feel like it's high.
That's good reasoning. Yes, it is an invertebrate. That is a red starfish.
Oh.
Echinaster, like I feel like that's a...
Well, there's like echinacea, which is a flower that's got a bunch of petals.
Yeah.
I don't know if that's related.
There's got to be something there about the points.
Aster, too. Isn't that like star related?
Oh, echinacea. That could be.
Yeah, I think so.
Yeah. We're just making up all kinds of stuff right now.
Astral is space.
All right. Here's one I hope Dr. Grunch can get here. All right. Panthera pardus.
I think Panthera, I'm thinking it's Panther. I don't know.
Another cat.
Yeah, you got it.
Cat. Oh, that's actual
vertebrate.
panther.
It's got a spine.
It does have a spine.
Excellent.
All right.
Leopard,
I wonder what size pedicle screws a panther will take.
Has anybody ever asked you your opinion on their pet's spine?
Oh yeah, absolutely.
What kind of inquiries do you get about that?
I mean, like Dachshunds and Chihuahuas, all those type of little dogs will have spine injuries, and it's actually fairly common. I actually worked with a pediatric neurosurgeon that performed spine surgery on animals, like kind of on the as a side. Yeah, it's kind of interesting.
As like a
on
side?
the above board or below?
Like it helped with that. I don't know if you have to be board certified to operate on animals. I assume you do.
I would think so.
There's some kind of certification, but
yeah.
people ask me, could I do their dog's cataract surgery? And I was like
technically, probably you could.
I could,
but you shouldn't.
Yeah, there are people that are trained to do that, but I don't know how similar the spinal anatomy is. I bet I could name some spinal anatomy.
Let's go for it.
Pedicles.
Well, she just said that. That's cheating.
Oh yeah, foramen.
Okay.
Foramen, good.
Spinous.
Yeah, spinous.
Oh God.
Second word.
Spinosum? No, that's in the skin.
Spinous process.
Spinous
is a portion. Spinous process is the part of your spine that you can feel when you poke on your skin.
Yeah. That's the
that
point.
part.
Yeah.
But spinosum is a portion of skull. It's a part of a name of where one of the holes where the nerves exits. Yeah.
I've got word.
What?
It's not anatomy.
What?
Spondylolisthesis.
Oh, that's a good one. That's one of my favorite words.
It's fun to say.
That's a good word.
That means we're doing a fusion.
Yeah.
Oh.
Yeah. I got another word, I think.
She knows this because she's had one of these. You didn't have a fusion.
I did not have a fusion. I had a well, hold on. Let's see. One second, please. I just coming up with another game on the spot if this will work. Let's see.
Let's do it.
I'm gonna test her neurosurgery knowledge.
Oh,
the neurosurgeon.
I'll pass this one.
I'm pretty sure she's
we
got
gotta give her an
down.
easy one after your disaster there.
Hey, Gallus. You're never gonna forget that's chicken.
Now I won't. Yeah, that's true.
And chickens have spines.
Chickens do have spines.
Chickens do have spines. Okay, let's see here.
You're gonna leave us hanging?
Nope, I'm just getting it. Okay. Okay, I'm going to give you the findings. Are you ready?
I'm ready.
On flexion, there's 1 millimeter retrolisthesis of C5 on C6. On extension, there's 1 millimeter retrolisthesis of C5 on C6, and 1 to 2 millimeters retrolisthesis of C6 on C7. I can't say these things. Yes. There's degenerative disc space narrowing at C5 to C6 with mild marginal osteophytic spurring. No displaced acute fracture is seen. Vertebral body heights are preserved. Prevertebral soft tissues are within normal limits.
So you had a C5-6 disc replacement.
I sure
did. Boom. Good. So within 3 millimeters of anterior listhesis is considered anatomically normal, and in your very young age, I would agree with your surgeon's plan of doing a disc replacement. So
yep, did that. I was having I was trying to think of the anatomy.
Radiculopathy.
That's not the word I was thinking of. That's
a good word though, right?
It is radiculopathy.
That is what I had. But there's a whole
a narrowing of the
tunnel there where the nerve goes through.
Yeah.
You know,
and foraminal stenosis.
Yeah. That's the thing. And I was losing function. I was just doing this all the time. No.
Yes.
I didn't even, when you got that, I didn't even know that you could do like a disc, like a replaced disc.
I think it's fairly new.
So how long you guys been doing that surgery?
Relatively.
I mean, really about more disc replacement's been around a really long time, but I would say within insurance policy, acceptable stuff in the cervical spine, about 10 years or so since I've been out in practice, it's becoming more and more common. And
insurance used to be like, no way.
No. And then, because they need long-term outcomes, and I've been long enough to have the 5 and 10-year outcomes. So then they could say it's the, acceptable, not experimental BS that they like to throw around. Yeah. So, and then they needed the 5-year data on 2 levels. So 2-level disc replacement's becoming more and more popularized in the past 5 years. So that's actually one of my favorite procedures, because you still retain the mobility of the spine, and you don't really eliminate motion, and it's more normal, and people can go on to.
I forget I even had it. I just
you probably maybe even feel better. Yeah,
so much better. It was awful before.
What's your favorite part of the spine to operate on?
Oh, cervical spine for sure. Yeah.
I gotta say though, as the patient, it is freaky. It was a real tough psychological pill to swallow those days before, and even after, knowing what happened. You go get your throat slit.
Yeah, throat slit. You go between the carotid and the esophagus, pull it open. You're like a millimeter on the spinal cord.
When you describe the surgery to patients, do you phrase it like that?
Just like that, I bet.
We slit your throat.
Yep.
Dig around the blood
esophagus
vessels.
And and they're like, okay, where do I sign?
I was really surprised that they go through the front, right? Because all the pain and everything was happening in the back. Yep. And so I expected it was going to be back there. So that was
why do you go?
Funny now, but at the time I was really scared about that. That really threw me for a loop when I found out it was through the front.
So what's really freaky is whenever we do it in the lumbar spine, I tell someone I'm going through their abdomen to get to their spine, and then they're really
doing it backwards.
It's just easier to get to the disc from the front. Is that
because the nerves all pass. If you come posterior through the back, you have to work around the nerves to get to the disc, and so the implants and stuff are a little more limited, and so it's a lot easier to go anterior, depending on what part of the spine. So, and patients do really well. There's no muscles here. I mean, this is just all the platysma, and that's it. So, post-op pain is usually pretty minimal. Back here, it's all the muscles there. So you cut through the muscles, it hurts like hell, and then they don't like you for a long time, and Yeah. So this is great. They go home the same day. They do great. And sometimes don't even take a pain pill. All their pain's gone. It's wonderful.
So you can do disc replacements throughout the whole spine, or is there a limit to how far down you can go?
Is a limit. You can go C3 to C7, and then all this stuff is kind of important that you can't really get through. So once you get down
to organs in the torso,
she is pointing to the heart and lungs.
Yes. And then down to L4.
She's my
L5.
kind of person. I call it stuff too.
It's body stuff.
Stuff
it's
in the body.
Irrelevant things that I shouldn't be manipulating.
Too funny. Well, there's a connection between you two that you may not realize, or between her field and you. Cervical disc replacement, you could argue, saved your life.
Oh, because you were able to do...
I had that 4 months before I had to do 10 minutes of CPR on him.
Oh,
and I was losing function in my arm, my right arm, which is my dominant one.
Dang.
Yeah, so I don't know how well I would have, how effective I would have been able to be had I not had that surgery.
You need to send your neurosurgeon a
thank
you card. Man.
I think I did already.
I didn't
for myself,
Yeah, I didn't put 2 and 2 together there. That's true.
Yeah, I didn't either till just now.
Look at that.
There you go, saving lives.
That's
Appreciate what you do, Dr. Grunch. Well,
that's what we're here for.
So we'll wrap up here, but thank you so much for joining us. And let's tell people where to find you. You are at Lady Neuro.
No, Lady Spine Doc. Why is this so hard for you?
I know. It's the 3 words back. I mean, anyway.
Lady
too many words.
Lady
Doc.
Spine.
They're very short words.
Yes.
Dang, you're right. At Lady Spine Doc, but you're all over social media.
Everywhere.
TikTok, everywhere. Just search it up. And you'll find
me. You'll find me. Grunch isn't too hard to find either. There's not many of us, so.
Yeah, that is a bit of a unique name. There's not a lot of Grunches out where you live.
No, it gets fun around Christmas too,
Oh,
so.
yeah.
I'm sure you've probably heard all the jokes.
Yeah. I've never heard it, not once. No, you're the first one.
Well, thanks.
Bless your heart.
That's right.
Bless it, yeah.
Well, thanks again for joining us. Pleasure talking to you.
Yeah. Thanks again. Y'all have a good one.
Well, I don't think I totally embarrassed myself with my spinal anatomy. I got a couple of terms.
Sometimes you dust the cobwebs off back there and pull something out.
Yeah. Glad we got to talk about our own health issues with another doctor. That's great.
Well,
She nailed that MRI report, though. That was what you're reading, right? Your MRI?
Well, I think it was an X-ray. Well, I don't know. Whatever it was.
It was an imaging report.
Yes, it was an imaging report.
It was like, bam, she got it.
Yep.
Exactly what kind of procedure.
That's right.
That's that expertise. It takes years to get that.
Yeah. See, that's the thing. Like, it sounds like it's going to be complicated and hard, all these words I'm saying, but that was way easier than this animal thing. For her, right? Like, as the expert.
Gallus.
Yeah.
Gallus and Dallas.
Chicken in Dallas.
All right. Well, let us know what you thought. Please no comments about the game. We're going to assume everyone thought that was awesome. And so also give us your ideas, give us your stories, give us your the guests that you want us to invite on the podcast to talk with. We'd love to hear what you think. You can email us, You can email us, knockknockhi@human-content.com. Visit us on our social media platforms. Hang out with us and our Human Content Podcast family on Instagram and TikTok at Human Content Pods. Thanks to all the listeners leaving feedback and reviews. We love those reviews. If you subscribe, only the positive ones, only the good ones.
I will accept and appreciate constructive criticism.
That's fine.
But I don't like insults.
That's true. Yeah.
Take those elsewhere.
Thanks to all the great listeners leaving wonderful feedback and reviews. We love those reviews. If you subscribe and comment on your favorite podcasting app or on YouTube, we can give you a shout out. Like today, we have @JoshGirl5999 on YouTube said, would love to see content on my own eye condition, retinitis pigmentosa. That's a good one. I just went through gene therapy to treat it in a clinical trial. Oh, that's so cool. That's like a brand new thing.
Yeah, clinical trials.
That's cool. Retinitis pigmentosa. I'm adding it to the list. All right. YouTube videos we have up every week on our YouTube channel at Glaucomflecken. So you can see all the episodes there. Knock Knock Hi and Knock Knock I is over there. We also have a Patreon. Lots of cool perks, bonus episodes, react to medical shows and movies, hang out with other members of our little community, our little hamlet, our little growing township. Early ad-free episode access, interactive Q&A live stream events, much more. Patreon.com/Glaucomflecken or go to Glaucomflecken.com. Speaking of Patreon community perks, shout out to the Jonathans, should we?
As always.
Patrick, Lucia C, Sharon S, Omar, Edward K, Stephen G, Jonathan F, Marion W, Mr. Granddaddy, Caitlin C, Brianna L, KL, Keith G, JJH, Derek N, Mary H, Susanna F, Jenny J, Mohammed K, Avika, Parker, Ryan, Mohammed L, David H ×2, Gabe, Gary M, Eric B, Medical Mag, Bubbly Salt, and Pink Macho. A virtual head nod to you all. Our producers haven't changed that up yet.
They did do David H ×2.
I thought they were going to mess with me a little bit. But
yeah, I'm disappointed to see that they have not.
Patreon Roulette, random shout out to someone on the emergency medicine tier. Geraldine R. Thank you, Geraldine, for being a patron. And thank you all for listening. We're your hosts, Will and Kristen Planner, also known as the Glaucomfleckens. Special thanks to our guest today, Dr. Betsy Grunch, Lady Spine Doc. Our executive producers are Will Flannery, Kristen Flannery, Aaron Cordy, Rob Golden, and Shanti Burke. Editor and engineer is Jason Portiza. Our music is by Omer Ben Zvi. To learn about our Knock Knock Hi's program disclaimer, ethics policy, submission verification, and licensing terms, and those darn HIPAA release terms, you can go to Glaucomflecken.com or reach out to us, knockknocki@human-content.com with questions, concerns, or fun medical puns if you got them. Knock Knock Hi is a human content production.
Knock knock, goodbye.
Hey, Kristen, you went to the doctor recently.
I did. I had my annual checkup.
Did they have a Jonathan?
They had a virtual Jonathan.
Oh.
Yes. In fact, it was a DAX Copilot from Microsoft. Yes.
Those things are amazing. I love them. It's just, there's just so much documentation burden.
Mm-hmm.
And I'm sure, did your doctor look you in the eye?
Yes, there was a lot of eye contact.
Isn't that great?
Mm-hmm.
It's just, and the virtual Jonathan, I'm sure it lifted your doctor's spirits.
Mm-hmm. Just put a pep in her step.
Just to be able to get through the day and actually have like a relationship with you
right.
Is a huge deal. In fact, 80% of physicians who use DAX Copilot say it reduces cognitive burden.
I believe it. It seemed pretty slick.
Yeah, and you just be more focused on what you're doing and just do what we're trained to do, practice medicine.
That's right.
To learn about how DAX Copilot can help you reduce burnout and restore the joy of practicing medicine, visit aka.ms/knock-knock-high. Again, that's aka.ms/knock-knock-high. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts, or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.